and welcome to Budget Brass Tacks, a show that cuts through the clutter and tells you what you can expect on Budget Day, July 6th. In this episode, we take a look at how the budget affects the ordinary citizen who depends on the government for health care. To learn more, we speak to our correspondent, Radhika Pandya. So, Radhika, we're in front of the All India Institute of Medical Sciences, where thousands of people come to seek treatment every day. And this is typical of many government hospitals throughout the country. So, clearly there's a lot of pressure on the healthcare system here. Tell us how this can change after the budget.
We can't really expect a huge change from this budget, but clearly we can expect major changes within the next 5 years. Currently, the government is only spending less than 1% of the GDP on healthcare, though this is something they want to increase to about 2 to 3% by 2012 through programs such as the National Rural Health Mission and the Urban Health Mission. But also there is a huge shortage right now of trained nurses and doctors. So currently in India, the ratio for nurses to patients is 750 to 1, and the global average is about 250 to 1. So there is that huge shortage that needs to be looked into.
So what are the big health schemes that are in place today, and how are they doing in terms of utilization of funds and actual delivery?
One of the biggest schemes of the government is the National Rural Health Mission that was launched in 2005. We are going to see a huge thrust for that mission now because of the government in power that really wants to take this forward. Another mission that is going to be launched now is the National Urban Health Mission, for which a sum of about 6,000 crores has been allocated. They have the Pradhan Mantri Swasthya Yojana that would include the 6 AIIMS-like institutions that are supposed to come up. Work has already started. Phase 1 has completed. So in the next 2 years, we can expect about 2 to 3 of these institutions to be complete.
So what has the National Rural Health Mission actually achieved? How has it helped people?
The National Rural Health Mission, since it was launched, they've gone to districts and they've gone to smaller villages and tehsils, and they've got link workers that are known as Ashas that are working with them. There are about more than 6 lakh Ashas trained now that can go to households, and people who are not well, they can bring those people to the district centers for treatment.
And what are some of the new schemes that are being introduced?
One would be the National Urban Health Mission that would be introduced hopefully next year. Already a sum of 50 crore has been allocated from this budget to start that scheme. That would be one which will look at the urban poor and the slum dwellers. So we can expect we will have link workers working with them to take them to primary healthcare centers. Another thrust we can expect would be in vaccinations, where the government is in talks with the civil society to develop a sort of vaccine policy so that you can have an overall immunization program that can be successful.
So right now only about 43% of children in India are fully immunized. So what kinds of changes are we going to see in the vaccination programs?
Well, that figure that you just quoted is from the National Health Family Survey. There's also another survey by UNICEF that quotes a figure of about 53%, and in polio, in fact, there is only about 61% children immunized. So what we are looking at now is the government wanting to push the immunization program deeper into the country so that there is more access to immunization. But also there is the whole issue of whether the government has the capability in terms of distribution to be able to do that. And for instance, we saw a resurgence of polio in a huge way after it died down in about 2006. So those are issues that are being looked into. That is why there is this talk about developing a vaccine policy as well. So immunization will be one of the key issues for this budget and the coming budgets, because the government is also wanting to introduce the pentavalent vaccine, which would have 5 different vaccines in one injection.
So healthcare is clearly a priority for the government, but it still has a way to go. Okay, thanks Radhika for the update, and thanks for watching LiveMint.com.